Peter, welcome to Return on Health.
Thank you very much. I'm so happy to be with you today, guys.
For listeners who have never heard of FunMed, in 30 seconds, who walks through your door and what do they walk out with they couldn't get from, let's say, the Swedish public system?
Yeah, when people come to us, they often come not for one problem. They have several symptoms, or it could be fatigue, gut problems, energy issues, skin issues, weight gain. And when they walk out of from our door, they have got not just a medication pushing down some of the symptoms. They got an understanding of their biology and also a plan for how to get all those underlying systems in order, so they can hopefully get rid of many of their symptoms.
You've treated, so you've been operating for 11 years. You've treated 5,800 patients. How can you prove that what you're doing works?
Because we are heavily data driven. So at our clinic, which is a functional medicine clinic in Sweden, in Gothenburg and Stockholm, we have been collecting data since really day one, because my background is from research. So we set up a system where we ask people in questionnaires to start with, and also follow-up questionnaires. So that is one way of proving. The other way is through lab markers that you can measure before and after. So we have quite an extensive database from more than 5,000 patients where we have evolved, of course. So it's not, this is real world data. So it's not been exactly the same all the time, but it's been evolving, and we've been better and better at measuring the right things. So now we have at least 1,000 patients where we got before and after data, which makes us in a position where we can in some way prove the effects of the care that we offer.
That's extremely interesting. Before we get deeper into the methodology, which I'm sure is extremely interesting, I first want to start with you as a person. You spent roughly 15 years inside Arvid Carlsen's lab, which is a Nobel tier neuroscience laureate, and about as orthodox as biomedicine gets. So my question is, how does a CNS pharmacologist end up running a functional medicine clinic?
Yes, the true answer is that I was very sick. I burnt out. So when I had been in the CNS pharmacology research for 15 years, I was transitioning into becoming a GP, general practitioner in Sweden. But after a few years, I burnt out totally. It was just a brain crash. So I had to find new ways. So this was not really an interest of mine that found this, or looking for alternative ways. I just had to find something else outside the regular healthcare system. So I found functional medicine in US, and I went there 2014, took a whole lot of courses. Even though I was not well, I was still sick at that time. But then I used functional medicine to heal myself. It works beautifully to heal burnout people, and including myself. And then I started the clinic, and I was trained in receptor signaling pathways, feedback loops, and all that. But when I saw these patients with the complex problems, and I started to really look at the body as a biological complex system, then I found that medicine that we practice today, that I was practicing in primary care, where I was when I went on, the models we used were much narrower than the biology itself. So I really expanded when I went into functional medicine, as everyone does when we do, because that's really a broad perspective on biology and on health.
Yeah, it's very interesting, especially if you went through something that was, I'm sure, a very difficult situation to navigate, and then not receiving the care you would have wanted, or at least that the care that was available didn't have likely the impact you would have wanted. Then looking for new ways. I think that's something quite a few people can relate to. And it's so interesting that given the background you've had before and the things you're doing now, how people might think that these things are contradictory, even though they might actually not be at all contradictory. And if you had to pinpoint it clearly, what's the one thing that you saw in functional medicine when you decided to dig deeper into it that functional medicine had that traditional medicine was lacking?
The number one thing is that we call it root cause medicine, and it's about always looking for the underlying causes, and not singular but plural causes of a disease, a symptom, or many symptoms in a patient, and try to correct the underlying causes. That is the main difference from the kind of healthcare that I was practicing in primary care, where the paradigm is really one ill, one pill. So you have one diagnosis, and you try to push down and correct something only by pushing it down. For example, then hypertension, you're supposed to take a pill to get your blood pressure down. And if you have a migraine, you will take a triptan. And if you got pain, you got an NSAID, NSAID, and so on. That is really the basis for most medicine practice today. Functional medicine is not really pushing on the side of medicine that is acute care or surgery or oncology or no, and infectious disease. But where the regular conventional medicine really underserves people is handling complex chronic disease. And that is 80 to 90% of the healthcare budget in most Western countries. So this is not small money or small problems. So I really came to understand that we are in an old system that was created in the 90s, and we are kind of trapped in that healthcare system, but we have to try to move on and really use all the new possibilities that we get with the computers, with the lab markers that we can measure, and analytical ways to analyze. And we also have a population of people that are very well versed. They understand much more. They have the internet, which we didn't have in the 1900s. So it's a totally new world, and we have to adapt. And healthcare is and should be quiet, conservative. It should be. It should not jump on the first new thing or the new longevity stuff or whatever. But it's really time now for healthcare to move on and get into more precision medicine, precision health. And in Sweden, we hear it everywhere. At Karolinska, when I was there at a meeting just 3 weeks ago, they were talking about precision health. I don't know, is precision health something that's pushed in Germany?
Not really, to be totally honest with you. I mean, obviously, same as FunMed, there are also, let's say, functional medicine practitioners in Germany. You can find them all over the big cities at least, but there's like no general system nationwide which would push anything even comparable to functional medicine really forward. Then there's also problems with insurances. They don't even cover, like, let's say, preventative measures extending really basic blood panels or blood pressure testing or colonoscopy after 50, which are all good on their own, definitely, don't get me wrong. But more than this, nothing is really, let's say, funded by insurances. So many problems, but I think it's quite similar to the system in Sweden. If I would guess, I don't know the system in Sweden.
Yeah, I actually agree. And I think personalized medicine is an interesting term because that's a term, longevity medicine or whatever it may be, that's something where people might have different opinions on. That's something where some might say, no, this is a hoax, or some others say, no, this is the future. But for personalized medicine, everyone agrees. Everyone agrees that medicine should be personalized, and we need to be very, very targeted in our approach. Yet everyone talks about it, and barely anyone really offers it. And so I think that there's this gap, in terms of funding, who pays for it, what are even the markers that people agree on that would lead to personalized medicine. That's also something that we will dig a little bit deeper in later on in this episode. And so I feel like that there's a little bit of a gap between theory, everyone agrees, and practice, barely anyone offers it, and patients don't have access to it.
And the meeting I was at Karolinska, I went up to the presenters afterwards because they have very much a hospital view of things, a viewpoint. It's precision medicine is very much about oncology, cancer care. Now, lung cancer used to be like 2 different diagnoses 30, 40 years ago, and now it's a host of different diagnoses because you can discern different underlying characterizations of the cancer. You can treat it personalized, which is a big possibility, but also a problem because who will pay for a cancer drug that maybe only has to treat 100 patients in a country in 1 year or even less? And then precision health is also a concept one speaks a lot about. But I asked the presenters at this meeting, do you have anyone I can speak to about precision health or precision medicine in primary care? But they just shook their head. We don't know of anyone doing this. So I feel quite alone in Sweden doing this, building this clinic where we had 5,000 patients working in precision health in a kind of a general practice, seeing patients with all kinds of diagnoses, symptoms, chronic health issues. So I don't know, have you seen that? Because I think in Germany you have a little bit broader view on medicine. You have a history of more kind of alternatives, more. I don't know. Would you educate me on?
Yes, I mean, in Germany, that's definitely both alternative medicine as well as naturopaths are both. There's quite a few available, and so people can access them if they pay out of pocket. But still, in Germany, the divide between traditional medicine and alternative medicine is still pretty strong, I would say. So it's still that, there is very little middle ground and very little things everyone agrees on. So it's either one camp or the other camp, and the camps seem to be very divided. And maybe it shouldn't be like that. Maybe that there is something that can be learned from each side and kind of create a new path that combines the best of both worlds. But yeah, I think that's why it's so interesting talking to you, because you are kind of not only offering that, having a very deep both medical as well as academic background, offering what people might consider alternative care, functional medicine, and also looking at the data and kind of, building a data case that tells at some point, probably very compelling story that this is actually the best way to go about this. And that's why I would love to dig a little bit deeper into what you do, because you start with first a very extensive biomarker testing. So if I understood correctly, you look up to, you investigate more than or around 200 biomarkers. And for some people that might look super excessive in the beginning because they are used to seeing 8 to 12 biomarkers on the annual checkup. If you had to explain to these people, what are you actually testing in the other 190 biomarkers? Why are they worth testing for? And what do you see?
Yeah, and I completely agree that might sound excessive. And I think in the future, we will not need all those biomarkers. And that's been my preface all the time from start. But to start with, when I started 10 years ago or even more, doing this and measuring all this stuff, I was completely aware of that. We won't need to test all these biomarkers, but how can I know which ones we need to test? I have to collect the data and together with others. And the thinking here is that I need the data because I was new to functional medicine. I needed the data to convince myself. I needed the data to explain things to the
That's
patient.
interesting.
And I needed the data to convince my colleagues. So we collected a lot of data, and we've been doing so in 5,000 patients. We have an immense database that I think is quite unique, since much of the data is also coupled to questionnaires. So, and just so people understand what we measure, it's, let's say, about 50 markers from a regular blood panel that you could measure in primary care, but you don't, because you would be bankrupt in months. So, and that's important. That's really important. Also to find if people are sick, because if we find someone with an hemoglobin of 80 or something, of course we send them to the regular healthcare system. We are not working to find this or such. That is not our main goal with all these measurements. And if we do, we of course collaborate with the regular healthcare, primary care or hospitals, whatever. So this is not really something that's going um, on the side, so to say. I mean, it's just complementary to the regular healthcare system, but we are going much deeper. So it's not only blood panels, it's also stool tests, and it's urine test where you can measure organic acids. And organic acids is compounds that are made in the body when you break down your food and your all this metabolism that's happening in your body. So it's really a way of looking into the body's cell machinery and see what works, what doesn't work, what kind of nutrient deficiencies can this patient have. And that's really an art by itself. And it's not perfect. No. It's so much more to learn here in how to interpret this. But the only way is to measure and also do studies and understand more. And then we also do breath tests, and that is to characterize something called SIBO, which is small intestinal bacterial overgrowth, which is bacteria growing up in the small intestine where you're supposed to absorb 90% of all the nutrients that you ingest, and where perhaps more than half of your immune system is located. This is a very underrated organ, in my view, the small intestine, where much disease really starts. So we characterize all this in almost every patient. And in that sense, we are not looking for disease primarily. If we find it, we send them to the regular healthcare system. But this is really to understand each patient's biological system. So it's another way of looking at this. And I'm really a biochemistry nerd also. I used to work with chemists in pharmaceutical research for 15 years. So my wife is really, she is thinking I might be a little bit too interested in that.
Yeah, I can imagine. I really applaud this way of working in medicine, using data to guide every decision. I really love this. That being said, I'm just wondering, just simply by chance alone, when you run 200 plus biomarkers, or like maybe 200 biomarkers or whatever the number will be, just by chance, if a fraction of the panel will eventually flag false positives or findings which may not lead to any actual disease or any actual problems. So what I'm wondering is, like, how do you avoid, let's say, manufacturing findings which doesn't really mean anything, or which don't hold any clinically meaningful data or lead to any clinically meaningful decision?
Yes, perfectly legitimate question, I think. And that is actually often the most common and also the first question I get from doctors when I explain the way we work. You will, if you measure 20 things, you will get one out of the reference interval. And to be honest, I've heard it a little bit too much, but I'll try to explain, because the thing is that we are not looking for one thing that's outside a reference interval that's pointing to a certain disease or something. We're looking at the system. So when I speak to a new patient, I tell the patient that we will now measure like 200 markers. Except for that, we also measure, ask about sleep and diet and all that. And you're supposed to have green lamps lighted for every market. But here, we're not only interested in red lamps and green lamps, also yellow lamps. So if you're a little slightly off, you have a little magnesium deficiency, you have a little bit too much of of mercury in your blood because you've eaten too much fish, or you have low-grade inflammation, you have a CRP of 2, it's supposed to be less than 1, and so on. The knowledge that a functional medicine doctor should have is to explain to their patient which are the yellow and red lamps, and how can you as a patient work on correcting each of your yellow and red lamp. And now you have also, if you're engraved in the conventional healthcare system, most people think of, well, which are the lamps that creates migraine, for example, the diagnosis of migraine. The thing is that it could be different things that are underlying migraines. In 3 different migraine patients, they have different underlying causes, but it all points to the diagnosis or symptom of migraine. So what we do is not treating migraine in a certain way. We treat always the underlying yellow and red lamps and try to get them in optimal. And that could be easy, it could be hard, it's different, but we are really good at it, I would say. And it's extremely powerful way of working. And it shouldn't be surprising that it is, because the body is a machine in one way that's a complex system. And if you correct a lot of things at the same time in the system, it can work so much better.
I think it's that's a great approach you're taking, especially also trying to look beyond the diagnosis or what actually sometimes may just be a description of a constellation of symptoms, and then actually looking, okay, what are the different subtypes of it, because they might have very different origins, or as you say, root causes. I really like that, because I think we way too often label people something, and essentially that's pretty meaningless, because it's just a description of a status quo, like the wall is white. And I think we have to be... What's going on with the sound? Do you hear? Okay. Anyways, we'll cut that. So I think that's great. What I would like to know, though, is you've said that you look at all of these traffic lights, so to say. Which ones have the highest priority for you? Because you say that if something is wrong in that system, it's definitely leading to issues, or might be, if people have several issues, might be the one that needs to be treated first.
In general, there are many different thoughts about functional medicine and how to approach it, and which makes it harder to get into regular medicine, because it's it's like a soap, what is functional medicine? How do you define it? There is not one real
How
definition.
do you define it?
Yeah, it depends on who I'm speaking to. For me, it's the data is very important. That it should be data driven, because on the other side of the spectrum, you could think about correcting root causes just by change the diet, or make them sleep better, or you can have just a little piece of the pie, so to say, and you can still make people much better. But in my world, it's functional medicine is a broad concept where you characterize the whole system, the whole body. I'm not saying that I'm right, but that's the way I believe it should be practiced, at least for if you want to bring it into medicine and get the full potential of doing it. So what was your question again, Miguel?
I think it's interesting how you defined it, and also we have to look at that the people you see are a very special sort of patients, right? Because they have been to other traditional doctors before, and these doctors have not been able to resolve their symptoms or improve their quality of life. And so in the patients you see, coming back to the traffic lights, what are the most important things for you to detect and treat that have the highest positive impact on people's lives?
Right. So, one, I think it's 2 separate questions. One is, what are the most important markers to treat, and then what are the most important tools or ways to treat these people, it's really two different questions. But when I get that question, I think you probably agree that insulin resistance is a really, really big driver of so much disease. And it's weird to me that you treat so many diseases in conventional healthcare without mentioning insulin resistance, without even measuring it. And so in our patients, we measure fasting insulin in everyone and has always done that. And that is the most sensitive marker of insulin resistance. And for those listening, insulin resistance is in general that your body do not want more energy, or more specifically, mostly not as much carbs, because carbohydrates drive up blood sugar, which drives up insulin and which stores fat on your body. This is a little bit simplified, but it's a very much well-working model of how you can work clinically with this. Because if you lower carbs, you can get down insulin and you can get people also lose fat. We've seen that over and over again in our clinic. So that's one. So insulin resistance is so important, and it's connected to 13 different cancers. It's connected to, of course, overweight and foregoes diabetes, Alzheimer, the heart disease. So it's just a big question mark why conventional medicine is not talking about it. It's like a big elephant in the room. In every general practitioner's room, there's a big elephant and it says insulin resistance, but you don't look that way. You continue because insulin drives up, for example, blood pressure. So if you get insulin down, inflammation down, you get blood pressure down in most patients. I had such a patient today where we got her inflammation down, and she's eating low carb also, and her blood pressure had now lowered, and she could quit one of her 2 hypertension drugs, and she was just been on those for 20 years. So it's just almost shocked that this could happen in just a month or so. So that is one. And the other one, I think, when we talk about markers, is low-grade inflammation. And I think many doctors are not at all aware of this, even though the science is there. And the American Heart Association in conventional medicine, they went out a few months ago and said that if you have a CRP is a blood marker that's supposed to be less than 1, and even better if it's lower than 0.5. And they said that if you have a CRP of 3, you're at much higher risk of heart disease. And that's in their policy document. So this been known for a long time, but I could just guess that there is no drug you can use to get inflammation down, low-grade inflammation in a safe way. But here in functional medicine, we work with the gut, because as we said earlier, most of the immune system is in the gut, because it's very logical, everything, because the gut has the biggest surface area. It's like a room or so. It's like a badminton court, the surface area of the small intestine especially. So the immune system must be there to patrol and not let anything bad in. So most of low-grade inflammation is driven from overgrowth of bacteria, of yeast in the gut of our patients. And that is why we focus so much with these stool tests, and we really try to understand what's happening in the gut. And in that way, I can show you with data, I can tell you many cases where we got low-grade inflammation down, and doing so, we can get high blood pressure down, we can get aches and pains down, and we can get depression down. And so it's a lot about gut health.
When I talk to a lot of my friends who are doctors as well, physicians, more involved in the longevity space, so not in the, let's say, conventional medicine, quote unquote, space, they also always, or most of the time, talk about insulin resistance. It's one of the key drivers of a lot of diseases, and that's one of the first thing you should treat. And also, just an N of one example, but also me myself, I was close to having quite bad insulin resistance. My HOMA index was 2.6, and I think, correct me if I'm wrong, but to be optimal, it's supposed to be at least under 1.5, under 1.2, maybe even. Mine was 2.5. The reference range goes to 3. So it was close to real insulin resistance, but obviously 2.5 isn't really good. For me, the main reason was carbs. Ate too many carbs and didn't, let's say, burn carbs enough. So I didn't do strength training at the time due to different reasons, but we won't get into this as well. But what we want to get into is tools. So what are tools to treat those things? Let's say low-grade inflammation or also insulin resistance. You mentioned a low-carb diet, for example. So, and you also, like on your website and on other platforms, you also talk about the ancestral diet as a tool. So can we maybe talk about this a bit more, like your protocols to really improve people, also improve their gut health, improve their inflammation?
Yes, let's see where we can start. The basis for our work and also for our clinic is low carb diets, to lower the carb. And one might say that it's my bias, because that was my way into this world. In 2012, tried a low carb diet when I was still on sick leave for burnout. And in 2 weeks, I lost several kilos of weight. I got rid of my aching joints. My gut, the IBS symptoms went away, and my brain cleared. So that is really why I'm here today, because that was even before functional medicine. But so I just understand there is a big black box that no one told me nothing about in med school. And since 2012, we've been going into that box to understand more of what creates health and how could a diet affect me in that way. But this is not a religion for me. This is just biology, because it's many people talk about things like it's almost a religion or some ideology, but this is not at all ideology. This is just trying to put logical thinking into the biology and the system. And I think, in my view, and this is not really functional medicine, this is evolutionary medicine. You named it ancestral diets, and that is really what I believe in also. So I think the power of FunMed and our work is that we are very much aligned. Every health coach, every doctor, of which I train them, all of them myself, at least in part, and we are very much aligned. We are thinking functional medicine, we are thinking gut health, but we are also thinking evolutionary health. Because I used to take the example that there are no, in Sweden we got, elks, with a like that, and we got roe deer and stuff, but there are no overweight elks. You never see an elk that is overweight or fat. Oh, what a fat elk! No, it doesn't. You don't see squirrels running into the hospitals and so. It's only our species, but in our species, it's just normalized. In Sweden, we are quite healthy population. 50% have a chronic diagnosis, and 54% are overweight. I think it's 16 or even 18% that are fat. And I mean, in the US, it's more than 40% that are obese. So we are not, we are pretty well off, but still we are doing something to our species that no other species does, except for dogs and cats that are living in people's homes and also get fat and sick nowadays. So I think that it's really something to reflect on. How could we let this happen? Because we are supposed to be rational, and we know a lot of things, and we spend billions of dollars into research of high-tech things, but still we are just letting this happen. I just think it's so suboptimal. So at FunMed, we are trying to apply evolutionary thinking. And my view of the world is not that we should go back to the savannah, but I'm often talking to my patients about the savannah. Think about how live if you were on the savannah in Africa, because there were no human beings outside of Africa until perhaps 70,000 years ago. So we were all there, our ancestors. And we probably lived in a small band of 50 or 100 or 150 people. We were nomads, we were hunters. For sure. I don't think there were for sure no vegan hunter-gatherers, but we were hunting, we were gathering, and we were probably eating a lot of meat. And we were not only meat, but also organs, and also brain and marrow, bone marrow, and so on. This might sound gross to many people, but I think in Germany you got nice bratwurst and other things that are probably contains a lot. What do you think? What's in your sausages?
Yep. I think the same.
I don't think the sausages are the best, to be honest.
No.
But I agree with you. I totally agree with you about that. We have created so much harm to our species by just weaponizing, in a sense, the whole food supply chain and giving people things that create so much disease. And you see that in the US more than anywhere else. And recently read a statistic that more than 90% of Americans are metabolically unhealthy, which is incredible. So and that's something where we should probably think about, hey, where did we take the wrong turn? Where did we start making wrong decisions? And I agree with that ancestral approach. I would still like to challenge that a bit, because there is quite a few people who are very smart, are working in the field for years and know about all of the nutrient requirements and all of it, and they come to a different conclusion and adopt a vegan / vegetarian / very low animal food diet. And it seems to be working out for some, even long term. I'm not talking about the ones who get rid of processed foods for 3 weeks and starts eating healthy for once in their life and feel better and run into deficits a year later. I'm not talking about these people. I'm talking about some people who are literally doing this for years and maybe decades. And it seems to be working for them. What extent is there, following this ancestral approach, is there bio-individuality and a personalized nutrition plan, or do we all metabolize things the same way?
No, I agree. I met patients that are vegan that have not perfect, but really good lab markers. It happens, but it's not common. And I had no bias coming into this about veganism or vegetarianism. It's just my conviction after working with thousands of patients and measuring so much on every patient and knowing how they eat and also seeing what happens when they change their diet and reevaluate after measuring again. I can tell you that I advise no one to go vegan or vegetarian, even if you don't measure a lot and you are really diligent to see that you don't get nutrient deficiencies. Because let's go into that then. Many people are just on the surface thinking at, well, let's save the planet, let's go vegan, vegetarian, it's very good for my health and for the planet. And I don't think we can go into all these arguments on all sides. Let's stick to health in this podcast. I think we can have another podcast. I was very into the climate and so on, but that was like almost at least 15 years ago. So I'm not going into that, but I'm aware of all that stuff. And I advocate for regenerative agriculture. That is what
I thought that already.
As a species, which is also trying to mimic nature, which is usually a good thing. So what I've seen is that I've met a lot of vegans and vegetarians, many more than I see out in society. So I just started to wonder many years ago that what's happening? Why are they coming here? So I think it's a risk factor for becoming ill. And it's also like many people that I see, they have an health issue and then they Google and they want to try to get healthy. And what is the healthiest diet? It used to be a vegan diet, vegetarian diet. for a long, long time. So they go there and they use it, and they might feel better, like you said. You might feel better because you usually get rid of stuff. You get rid of you might get rid of as a vegan, of eggs, of dairy, which can both are not ancestral foods. They can trigger your immune system and give you all kinds of bad reactions. You might even live healthier by not eating that much sugar that you did before, or so on. There's so much that can get better, just like it can get if you change from a standard American diet or even a standard European diet, you can get better changing to almost anything. But okay, so that is what. But so that my reasoning was, first, it was like, okay, this is logical, but they get nutrient deficiencies. I see this widely in the samples we take. So it's of course B12, which is only available in animal foods, but it's also zinc. Zinc is really important, and it's really grown in my view over the last years. I see people feel better when they get more zinc, and zinc is really an argument for eating red meat and not only fowl or like chicken and so on, which has much less zinc. And you see other B vitamins are less prominent in vegan foods, like B2, B6. Many have nutrient deficiencies there. You don't get carnitine, you don't get creatine, you don't get protein as much because it's not bioavailable, and you don't get all the amino acids, the small pearls in their necklace that are the necklace is the protein, and the pearls are the amino acids that are making up the necklace. So you need 20 different amino acids of which like 8-9 you have to get from diet, but as a vegan or vegetarian, it's harder to get all those 9. So we see this. So this was really the first step for me to understand that they get nutrient deficiencies, and we've seen that all the time. But then I understood also there are more problems. So next step for me was to understand that if you eat protein only from plants, then you get as much carbs as you get protein. You can't get low carb diet. So many of the vegetarians were overweight, and they also fed their gut dysbiosis, the imbalanced gut flora. But the third step, it was understanding anti-nutrients. And that is something that has been a game changer for us, because we've been really trying to push. We are not really listening to authorities. We are listening to the data and what works and how does it work. And we speak to our patients, have lots of time to talk to them, put a lot of questions. We have data. So we really understood that anti-nutrients can be a big part of health issues. And we can talk about that later on if you'd like to.
Yeah. I want to push back a bit here also for the listeners, or I want to challenge this a bit. When we look at broad or like the biggest epidemiological studies ever done in the US specifically, where there were like, I don't know, 10,000 people enrolled, and they were followed about 5, 10, 20, 30, 40 years. Some studies done at Harvard Medical School, for example, Nurses' Health Study as one example. We often, and most of the cases, almost always see at least correlation between red meat intake and cardiovascular disease. So that's one thing I want to ask you, what your experience is on that subject matter, because we have so much data, so much strong data as well, which shows at least some correlation. And then also same thing with anti-nutrients, phthalates or oxalates or whatever you name it. We also have some data on this as well. For example, oxalates can potentially cause, or like at least are strongly correlated with kidney stones. That's one thing. So what I'm wondering is, what does your data show that all of the mainstream, or let's call it mainstream data, doesn't get wrong, or are they testing for the wrong thing? Why is the data so different, or why is your opinion on this subject matter based on data so different than the mainstream data, the mainstream studies?
Yeah. The thing with nutrition research is that it's crappy. It's and don't just take my word. You can go to John Ioannidis, Ionn Ioannidis. John Ioannidis. He's one of the most cited scientists ever. And he wrote a piece in JAMA, prestigious what's it called?
Journal.
Journal, thank you. A prestigious journal in 2018. And he basically said that nutrition research has to be just restart, just do it right, because it's so much associated.
Turn it off and turn it on again, right?
Yeah. There is so much over interpretation of data that is just associations, because one must understand the way it's done. It's food frequency questionnaires, FFQ, and you ask 1,000 people or even more, 100 questions or 20 questions. How much meat did you eat? How much fruit did you eat last month? And how many bananas, etc. And then you ask them perhaps again after 10 or 15 years, and you see how many died, how many got sick, and so on. But this is not very sharp way of doing research, because Nico, how many bananas did you eat 3 weeks ago?
Yeah,
You have no
recall
idea.
bias, definitely.
No, I mean, we don't remember that well. That is one problem. Then it's all just looking at correlations. You can't really dissect cause and effect. So when you say that meat, I don't agree that there is strong data that meat causes either cancer or heart disease. If you look at smoking, you got like 30 times increase of lung cancer risk, for example. If you have meat as a cancer, for example, colorectal cancer, where it's been implied in some studies, it's like 1.18, I think. It's not like 30, it's 1.18. And if it's below 2, the increase, it's not even something you usually care about in these kind of studies. So I think it's mostly a thing that you got a bias, because these people, when they had their red meat in the US, for example, they had it with a bun and also French fries and a milkshake, for example. And they are also more sedentary and they smoke more, etc. They're just less healthy in general because they don't follow the advice. So that is my take. And I've been reading all these studies for 10 years that have been coming out, and so I don't give much for those, and I'm not scared. And also, I mean, we've been eating red meat for 2.5 million years, and just look at the cave paintings down in the big caves in Europe. It's all about hunting, and so I think red meat has been an ancestral food. Of course, we have to produce it in a way that's not cruel to animals.
Sustainable, yeah.
That's another issue.
Yeah, and it also affects the, how we absorb and metabolize it, right? What the animal has been fed, whether it's the grass fed or whether it's industrially fed, this also plays a role. And coming back, zooming out maybe again a bit more, and I think you definitely gave some very interesting points that many will like and many will not like, but I think that's exactly the point of why we're doing what we're doing. But zooming out again, you're currently building the biggest functional medicine clinic in Europe. You have probably the strongest data set already. And now, very recently, actually on the 29th of April, there was a news article coming out that Parsley Health, which is some sort of competitor of yours in the US, becomes the first functional medicine provider to accept insurance nationwide. What does that mean for you and the field of functional medicine?
Yeah, me personally celebrated that, of course. And I know that it's coming because I've been following this field closely. But it's a great gift that this happened, because that will make us being able to move faster. Because it's hard to convince people that a new care model like functional medicine is, that FunMed is, that it's one, medically plausible or medically right, medically useful, and second, that it has economic value and in health economics. And this just in one big cut of the sword shows that if 150 million Americans now can use functional medicine through Parsley Health, that just tells us both the answer to both those questions, that it's medically useful and it's health economics wise also working out. And we have always looked at Parsley Health as our closest peer in the US. And I don't know right now, but they were like 50 physicians, not only MDs. Like we are right now 5 MDs at FunMed in Sweden, but they're like 50 and they're serving all over the US and the digital. It's quite similar. I don't think my view is not that they are as streamlined as we are, because they are hiring people from all over the US, so on. And I think it's amazing what they've done. And hat off to Robin Bursin, who is the founder. She founded this 2016. She's been doing an incredible job. So, but this opens doors.
Yeah, definitely. And I think that's a great future ahead for you, especially regarding this news. So I'm really looking forward to any news coming up with your company now being accepted by insurances across Europe in the next couple of years, hopefully. This has been an amazing conversation. And as we are coming closer to our end, we have one of our the last section, which is our rapid fire section, where we will ask you short questions and you have only 30 seconds to answer to each question. Without further ado, I would say let's begin with the first one, which is, what is the single most important biomarker most people are not tracking right now?
We already mentioned it, fasting insulin. I think that would make the biggest dent in health if people understood where they are on the spectrum of insulin resistance.
Interesting. And then the one supplement you think everybody should be taking that's underappreciated right now?
Still magnesium, I think. I think that is what affects people's well-being.
Which form would you recommend?
Yes, I used to say to my patient, it should end on AT, not on oxide. It should not be hydroxide or oxide. Those are more cheaper forms of magnesium. That could be good if you want to clear your constipation. But otherwise, AT, like glycinate or malate or taurate, or there are many different forms, but they're in general good, all of them. And I wouldn't overthink that. I would get the magnesium in, and it's usually between 200 and 400 milligrams a day. That for most people would make a difference.
Makes sense. What is one thing you do for your own personal health that you can't fully justify with evidence as of now?
I think it's eating a carnivore diet at times. For example, I'm not on a carnivore diet all the time. After Christmas, for example, last year and this year, I ate only meat for 1 month. And when we look into our database, we can see that that is the intervention that makes people feel better more than anything else. In just eating a carnivore diet for a month, which is eating only meat. Might sound crazy if people have never heard of it, but it's all based in physiology, ancestral thinking, nutrients, and so on. So this is a separate podcast, but I do it myself just to when I feel that I have had too much of the Christmas candy and sugar and all that stuff and alcohol and so on, and I just clean my system out. Both years, this is the month I felt the best. No pain after exercise, just level energy and so on. I'm not telling people to do this without talking to their doctors, especially if you are on hypertension drugs or diabetes drugs. It could even be dangerous. But read up on it, and we will publish on this because we got data on treatment like this, what this can do. But I just need to get some funding in place for both our company, for our development plans, and also for research. So if anyone listens and want to fund research in this space, we got so much data that just awaits publication.
Interesting. Very interesting. If you kind of building up on that, if you could run one study with unlimited funding, what's the first thing you would test?
Yeah, I would love to do functional medicine and test that on par with just regular healthcare and see what are the different outcomes of that for on a broad sense. Of course, you can test it for a special diagnosis that would work fine, and also measuring health economics in that over a long time. So it would have to run like 2, 3, 4, 5 years, I guess, and measure that. And as a pendant to that, I can just comment that in our database we have so much data before and after, but in Sweden we got very good registers from healthcare, from sick leave and use of different pharmaceuticals and stuff. So we could actually do a study right now, which we hopefully will do, where we kind of pair our data to this register, so we can see a patient's consumption of pharmaceutical, how sick they were before and after. So there is a lot of very interesting things that are quite low-hanging fruits that doesn't even need a new prospective study. But a prospective study would be where I would put the money.
Yeah. Makes sense. Coming into the last question, which every guest needs to answer, the return on health question. If you could change one thing in the current healthcare system, one structural thing, not a wish list, what would it be?
That you get reimbursement for health outcomes, not only visits.
A lot of sense.
Count diagnosis, procedures, drugs, number of visits. No, we should measure outcomes.
I love it.
It's really worth something.
Yeah, that makes a ton of sense.
Love it. Absolutely love it.
Peter, this has been an amazing conversation. We will most definitely do another podcast. There are a ton of 1 million things I still want to talk to you about, especially in regards to nutrition, carnivore diet, all of those topics, anti-nutrients, all of those topics. So we will most definitely do an episode just only about nutrition, all of your data you gathered. So yeah, there will be definitely a podcast coming up. But as of now, thank you for bringing answers to also uncomfortable questions.
Yeah, but I must say I'm a little bit disappointed. I was expecting more uncomfortable.
Yeah, in the next episodes there will be more. Just time is running up. Sadly, I do have a ton of more challenging questions.
I
that's
think what
for sure.
we've done today is making people hear more about you, and we will definitely make sure that people get to hear more about you, where we can delve deeper into very specific things. Because we actually wanted to discuss 4 more topics that we didn't get the chance to because it was just too interesting, and we will have to do another one. So thank you so much for your time and for bringing your very valuable insight, knowledge of seeing all of these things firsthand and being a pioneer in that field, bringing it to our guests today. Thank you so much.
Yeah, thank you for this deep dive. And I just want people to know that I'm in here to really try to push the envelope for Europe and make functional medicine a part of the European healthcare system. That is what I'm will spend the coming 5 years to do. So we'll talk again.
Love it.
Thank you very much.
Definitely. Thank you so much. And to listeners, see you next week.